Okay, so this is the third chapter of BD. It is about joints, and when you will go over these notes, then you will find reading the book very easy. So let's start. The first thing is what is arthrology and what is syndesmology. Arthrology is basically the study of joints, and syndesmology is the study of ligaments which are related with those joints, right? In one word, if you have to describe a joint, it is simply a junction, right? And what is the junction in between? So it is between two or more elements, and those elements could be bones or those could be cartilages, right? So a joint could be a junction between two cartilages or between two bones or between a bone and a cartilage. So all of these are possibilities. And why do we have joints? So, in one word, if you have to describe its purpose, that is movement. But many a times there are joints and they are not having any movement, right? So, if there is no movement at a joint, then its next purpose is for growth. And after that growth is completed, the joint vanishes, right? That is the same reason why children have more joints than adults because they're in their growing phase and many of their bones have joints, and as they age and the bones grow, and when they grow those joints disappear, right? So next is the classification of joints. So joints are classified on three bases. First is on the basis of structure, next is function, and the third one is on the basis of regions. So here you can see that there are three columns and three rows, right? Now the purpose of making this is I'll explain in a while. So first see, in the first column I've written structure, and underneath the structure you have three types of structures. It could be fibrous joints, it could be cartilaginous joints, or it could be synovial joints. Fibrous means there's a fibrous tissue, cartilaginous joints means that there is cartilage in between the two bones, and synovial, so there is synovial fluid in between the two bones. The next is on the basis of function. So on the basis of function, again the joints are of three types. Synarthrosis, remember this word syn, right? It means no movement, right? So synarthrosis, the joint has no movement. Amphiarthrosis, amphi means in between or double, so it has some movement but the movement is restricted. And diarthrosis, so there is a free movement. So on the basis of region, the joints are divided into three types. The joints in the skull, so they are skull type, the vertebra type, and the limb type. Now, these columns represent how the joints are divided on these three bases. But if you see these rows, so I have written in front of fibrous synarthrosis, and in front of synarthrosis I have written skull type. So all of these three mean one and the same thing, right? So if I say skull type joints, it automatically means that those joints will most probably be fibrous. And if I say fibrous joints, so fibrous joints automatically means that they would be synarthrosis type joints, which means there will be no movement, right? The next is the cartilaginous. So in cartilaginous joints, they are of two types, primary and secondary. The primary falls in the first row, which means it is synarthrosis and that there is no movement. But the secondary cartilaginous joints are amphiarthrosis type, which means there is some movement, but the movement is restricted. And they are mainly present in the vertebral column. So if I say the joints are vertebral column, what should come to your mind is cartilaginous joints, right? Synovial. So synovial joints are diarthrosis, which means there is a free range of motion and they are mainly in the limbs. So you have to remember these columns because that is how they are classified. But if you remember these rows, it would make this very easy. This central column, the function one, I will explain this first and then we'll see the structural classification. So in functional classification, you have three types: synarthrosis, amphiarthrosis, and diarthrosis. Now in the first figure you can see that there are two bones and in between them there's a fibrous tissue, and this is simply the synarthrosis type of joint where there will be no motion, right? Because these bones are connected by fibrous tissue, right? So the next is, again you can see there are two bones and they this time are covered by a cartilage. On both of the ends are not bare this time, they are covered by a cartilage, and that cartilage is the hyaline cartilage, and in between them there is a box, a slightly colored box, and it is the fibrous disc. So in the synarthrosis type where there was no movement, there was fibrous tissue in between the two bones, right? And the ends of the bones, they were bare, right? But this time they are covered by hyaline cartilage, and in between them there is a fibrous disc. And the third thing that you can see here is that the ligaments which are supporting this entire structure are fibrous ligaments. So this is amphiarthrosis type of joint. The last one is the diarthrosis type of joint, in which there is free motion, right? So this time there are two bones. Again, they are covered by hyaline cartilage at both the ends, and this hyaline cartilage here, it is also known as the articular cartilage. And remember one thing about this, that it is bloodless and nerveless, which means there's no blood supply to it and it does not have any sensations, right? This time there is no disc or tissue in between them, rather there is fluid this time, and that fluid is contained in a capsule. So this is the joint capsule, right? And the third thing is that the ligaments this time, which are supporting the structure, are elastic ligaments. So next is the structural classification. So we've seen the functional one, now we'll see the structural classification, the fibrous, the cartilaginous, and the synovial joints. So this is about the fibrous joints. Fibrous joints are further divided into three types: suture, syndesmosis, and gomphosis. Now let's see suture. The basic structure is the same. There are two bones, and in between them there's a fibrous tissue. And another point is that the area of the suture is inversely proportional to the age, right? So in children or in newborn, the sutures, so when I say suture, it is a fibrous joint, so it means it will be in the skull, right? Because fibrous were the skull type joints, and it is also synarthrosis, so there will be no motion. Now in the newborns, their skull have sutures which have a lot of space in between them, right? And that space is needed for molding, because during the time of childbirth they have to pass through the birth canal, and in the birth canal these bones, they overlap each other, right? So that space in between the sutures is intentional so that the bones can overlap, right? An additional thing in the suture joint is that there's a bone, and bone, as you know from the last chapter, that it has the outermost covering periosteum, but after that periosteum there is another layer of osteogenic cells, and that layer is known as the cambial layer. And after that cambial layer there is a capsular layer, and that capsular layer goes and it connects with the periosteum, right? And these two ends of the bones, they will combine and they will connect with the help of the fibrous tissue. Then the second type of fibrous joint is the syndesmosis, right? Again, the basic structure is the same. There are two bones, in between them there's a fibrous tissue. Why it's different from a suture? That this time the fibrous tissue, it could be replaced by a ligament and it could be replaced by a membrane, right? So the example where it has been replaced by a ligament is between the tibia and the fibula. So let's imagine that these two columns that I've drawn are the two bones, tibia and fibula, and in between them there is a joint which is an interosseous joint between two bones, right? And this interosseous joint is made up of ligaments, right? So two ends of the bone, this time they're connected by a ligament, and this is a fibrous joint. And which type of fibrous joint it is? It is syndesmosis, right? And at some places this fibrous tissue could be replaced by a membrane, and example of that is the sacroiliac joint, right? Next is gomphosis. So gomphosis, it is a joint in your gums. So it is between the alveolar bone and your tooth, right? And this time also between the bone and the tooth there is a tissue, but that fibrous tissue is replaced by the periodontal ligaments, right? In syndesmosis there were two bones, right? So, but this time there's a bone and a tooth, right? So that is why it is not similar to syndesmosis, rather it is a special type, gomphosis, right? So with the suture joint there is one thing left, that I have to explain the types of suture, right? So let's say that this is a joint, there are two bones, and in between them there is a suture, right? So when this suture is a plain line, a straight line, so this is known as a plain suture, right? And in the next image you can see that it is a bit zigzag, right? So this is known as a serrate type of suture. So next is the squamous type. Here it is neither straight nor it is quite zigzag, but it is inclined, it is an oblique line, right? Next is dentate type. So here you can see, so the suture gives a toothed appearance, that is the dentate type of a suture. And in the last one you can see that there is a beak, and that it's like the Lego pieces, right? It goes and fits into another piece, so that beak fits into its corresponding piece, right? And what's important is that you have to remember where these sutures are present, right? Not just only the types of sutures, but where they are present. So the plain suture are present in the internasal region. So let's suppose that this figure that you can see in red, it is a view of a person, but this is a bird's eye view, of a person's head, and this is his nose. In the nose, there are two bones, and in between those bones is a suture, and that suture is a plain suture. So, plain suture is present in the nose internasally between the two nasal bones. Next is the serrated type. These are present interparietally. So, these are two parietal bones, this one, and in between them, this line, this suture is the serrated type. So, it is not plain, rather, it is zigzag type, right? And next is the squamous type. So I told you it was neither plain nor it was quite zigzag, it was oblique. So that type of a suture is present between the temporoparietal. So here it is the temporal bone, and between the temporal and the parietal here you have oblique type of suture. Next is the lambdoid region. In the lambdoid region, the suture that is present in dentate is dentate type, right? Dentate, which means there would be it would have a toothed appearance, right? So the lambdoid suture is here, and here you will find a dentate type of suture. And the last one is shindylisis. So it is present in the inside the cranium, where you have the rostrum. Rostrum means beak, right? So here where you have the rostrum, sphenoid bone has a rostrum, and vomer bone has the ala for that rostrum, right? So it just goes and fits into that ala, and that is shindylisis type of a suture.